Hey everybody, let's talk about testosterone therapy options. So we're going to be talking about the types of medications that are available, the prices, and also some adjunct medications that can be used with testosterone therapy in certain cases. So starting off, the most popular choice is testosterone injections. This is the one that's tried and true. It's what you see most studies based off of. And it also happens to be the more affordable, which is one of the reasons why people tend to pick this one over others. So with injections, they're generally going to be prescribed once weekly. Now that can also depend later on how the person is tolerating it, what stage of their transition they're in, yada yada yada. But for practical purposes, we'll start off saying they are done once weekly. The cost of these is going to run depending on whether or not you're paying out of pocket or with insurance and everything. We're just going to be focusing on out of pocket. It's going to run somewhere between either about $20 to $40 per month, or somewhere between maybe $40 to $80 for a 90-day supply. Now it can depend, if you have insurance, sometimes insurances will only allow you to have a 30-day supply at a time, and some pharmacies are only going to distribute a 30-day supply at a time. So the price there and the amount that you're receiving and time-wise and everything can differ. That's based off of too many things to really predict. But for most practical purposes, it costs about $30 a month, or about $70, $80 for a 90-day. So you can see why these are a pretty reasonably affordable option for most folks. Next, we're going to talk about more the cream and gel. Cream, gel, either one is fairly interchangeable. The only real difference here is going to be like texture. A lot of times they tend to absorb pretty similarly. Everybody's got different skin and everything, and everybody's got different texture, feel issues and stuff like that. So one may be more beneficial for an individual over the other, but for most practical purposes, they're pretty similar to where we don't have to get down to the nitty-gritty of what's different between them. This is going to be applied usually once per day. Every now and again, it's going to be applied twice per day. Just again, depends on how the individual is doing with it and processing it, how they feel on it. In regards to cost, these are going to be a little bit more cost prohibitive for some folks, as the general cash out-of-pocket price at your run-of-the-mill pharmacy down the street is going to run you somewhere between $60 to even up to $150 a month. And usually it's going to be more towards the higher end of this price range, more around $100 a month. It's rare to find it cheaper than that, but some people do, and hey, that is great. But anyway, so about once a day, sometimes twice a day is pretty well tolerated, but you do have to worry about transference because it can come off of you and get on someone else for a certain amount of hours after it's been applied. This is something that we will discuss with you if and when that is something you are wishing to try. But anywho, it's generally well tolerated and people do very well on it transition-wise. Next topic is going to be rather short. It's testosterone patches. These are very prohibitively expensive, and it's very rare for insurance companies to cover them at all. Patches cost anywhere from $200 to $500 a month. They're changed out every day. And while the idea of them is nice, having, a nice steady stream of testosterone, the price just makes me just totally cringe out. So anyway, if you do have one of those few insurances that will cover it, great. Or if you're independently wealthy, hey, patches is a good choice. But for most folks, patches are going to be a little bit out of reach, including myself, goodness. But anyway, so those are the three main kinds you're going to see of testosterone: is injectable, cream or gel, or we just call them topical, and then patches. Now, moving on, there are some medications that can be given with testosterone therapy in certain situations, and this is going to be your typical, like people refer to, birth control. Well, it's not just for birth control. It can be for people who perhaps get on testosterone and they have their cycle is not quite doing what they want it to do, because up to 25% of people will not have a cessation or a stopping of their cycle when they're on testosterone therapy. And sometimes adding something like birth control in there can really make the difference in getting that sucker to stop. Additionally, there's another class of medications, a couple out there. I'll just throw out one example is anastrozole. So anastrozole actually, decreases the levels of estrogen that are being produced by your body. And when we use these, a lot of times we are using them to lower your estrogen in order to get that menstrual cycle again to just shut down. Like I said, sometimes it's not a guarantee. As long as you have the parts, things can still happen, but these are adjunct medications or extra medications that we may or may not end up using with your testosterone therapy somewhere down the road. I just want you to be aware that there are other meds out there that may or may not be talked about in case you have questions about them, or in case you run into one of these issues where you need to start asking questions. And always, always, always ask your healthcare provider if you're having any issues, any questions about something, because you never know. We've been asked pretty much everything at this point, and if you have something going on in your mind, we would much rather you get it out there and feel a little bit better about it. So that was your testosterone options with a couple of extras in there, and when you see your provider, just ask them any other questions you might have. All right, have a good day. Bye.